Good afternoon. Before we begin the program, we just want to go over some housekeeping guidelines for today's Google Meet. Please keep your phones muted. If you have a question, please type your question using the chat feature. This program will be recorded and posted on our website, hunterdonhealthcare.org, and also our social media pages. Like us on Facebook, Hunterdon Healthcare, and follow us on Twitter, Hunterdon Health. Thank you.
This is our second program in our series that will be held every other Monday from noon to 12:45. As of now, these programs may focus on COVID-19, but our plan is to present many wellness topics throughout the year. Today, we will focus on what to expect at a Hunterdon Healthcare COVID-19 vaccination clinic and a vaccination update. I'm joined today by our Hunterdon Healthcare experts, Dr. Geralyn Prosswimmer, MD, Chief Medical Officer of Hunterdon Healthcare Partners. Dr. Prosswimmer is a graduate of Rutgers School of Medicine and completed her residency at Thomas Jefferson University, where she was the Chief Residency Officer. Dr. Prosswimmer has served as the principal investigator for several other vaccine studies, giving her a deep understanding of vaccine science. I'm also joined today by Rose Pulley, Ph.D., Administrative Director of Population Health and Data Integrity, Hunterdon Healthcare Partners. Dr. Pulley guides the Intra-Agency Population Health Committee, bringing data analytics and evidence-based practice to the design and implementation of our population health initiative. Prior to her current position, she spent a decade in public service at the state and county level in public health preparedness. Dr. Pulley received her Ph.D. in microbiology from Cornell University Graduate School of Medical Sciences in New York. I want to thank everyone who submitted their excellent questions in advance. Just to describe the format, I will be asking the questions and one of our experts will respond. As a reminder, please keep your phone on mute and you may submit questions using the chat feature on Google Meet during the program, and we will address those questions at the end. Before we get to the questions today, we are going to show you a video of what our Hunterdon Healthcare Vaccination Clinic looks like and provide a tour of the clinic at Hunterdon Medical Center.
Welcome to Medical Mondays, Episode 2. I'm Patrick Gavin, President and CEO of Hunterdon Healthcare. Today we're going to talk about what to expect when Hunterdon Healthcare sets up a mass vaccine clinic. So that you will be introduced to how to arrive there, what you should expect, and be educated a little bit about the vaccine.
Let's begin with explaining where the clinic on our campus is located and how to find it. First, enter through the main entrance off Route 31 onto Westcott Drive. As you approach the hospital, look to your left and you will see signs with our heart logo on the road that will lead you to the clinic. There will be safety attendants along the way to help guide you if necessary. Follow the signs to the rear of the hospital where you will see an attendant station at the stop sign. The attendant will ask if you have an appointment. Please remember that you must have an appointment to get the vaccine. We are not able to vaccinate individuals without an appointment. The attendant will take your temperature and ask if you've had any symptoms related to COVID. If your temperature is normal and you have not had any symptoms, he will provide you with a vaccine questionnaire to complete before you enter and ask you to park your vehicle. Once you have parked and completed your questionnaire, you will walk down to the rear entrance of the hospital where you will see large informational signs and likely a short waiting line. You will not be able to enter to receive your vaccine until your time window has arrived. So please do not take a spot in line any earlier than 5 minutes before your scheduled appointment. So our first guest today is Dr. Rose Pulley. Rose has extensive public health experience specific to large vaccination clinics. So Rose, based on your past experience, why is a vaccination important and how safe is this particular vaccine?
Well, vaccine is extremely important because it offers the most protection available to a deadly disease. COVID-19 has killed over 400,000 Americans, and getting a vaccine safely and effectively is the most protection you can provide to yourself. It's really an act of kindness. You're being kind to yourself and supercharging your body to protect you from this virus, and you're being kind to your friends and family so that you can interact with them safely, and you're being kind to your community because you're helping protect us all.
And how safe do you think it is, Rose? Is there any flags there?
It's very safe. It had an accelerated process, but it still went through the FDA approvals that are necessary for a vaccine. Vaccines are one of the most regulated products in America.
And Rose, from your extensive background in public health, how does this pandemic compare to the likes of Zika, SARS, and even just the annual flu?
It's much larger and much more deadly than other pandemics that we have experienced here in the United States. And particularly, it's causing changes in lifestyle. And one of the big factors here is that we're seeing increases in hospitalization of patients. So the number of people who need to be treated for this disease is more than we've seen in other pandemics.
Great. Thanks, Rose. Now, another couple questions here. So how will the clinics here at Hunterdon be staffed? Can you just talk a little bit about that, and then we'll get to others that will get into more detail.
We have wonderful staff here at Hunterdon Healthcare. And the clinic team is composed of really two branches. The first branch is our clinical team, and that is composed of our vaccinators, and they man the immunization stations that people will sit at to actually get their doses of vaccine. It's also composed of our pharmacists who prepare all our doses. And then there's an administrative staff who provides a registration process and also the documentation to upload our information to the New Jersey immunization information system so that we can account for every dose of vaccine that we receive.
Rose, you touched on this, but could you speak a little bit? There's lots of questions that I think folks in the public have about how the vaccines are prepared and how quickly do they have to be administered?
They have to be prepared very carefully. So we have special freezers here for the Pfizer vaccine and medical grade freezers for the Moderna vaccine, and the other vaccines will be stored in appropriate conditions also. But once they're thawed, they have to be used within a very specific time frame. They have to be thawed in a very special way. And then once they're put into a syringe to be delivered and at room temperature, they have to be used within 2 hours. So when we do a clinic, the pharmacists are constantly preparing vaccine as people move through the clinic.
So Rose and I are entering the clinic at the hospital site, and we'll take you on a tour of that. But actually, as time progresses, we will be running these clinics in different locations throughout the county and even into other surrounding counties where Hunterdon Healthcare serves significant populations. So now I'm going to take you inside the hospital vaccine clinic. And the first person that's very important to meet here is Tony Rice. Normally, Tony is a human resources director who takes care of benefits and wellness for our health system and all of our employees. But like many people in the health system, during the pandemic, Tony has assumed more than one role. And Tony has taken on the very important role for us of being our clinics manager, our vaccine clinics manager. And Tony's going to talk to you about the front end when you come in, how you register, how you get received into the clinic, et cetera. So with no further ado, I'm going to turn it over to Tony to walk you through that process.
Thank you, Patrick. When patients begin coming through the registration area, they'll come through the main door. They will be greeted by someone that's going to verify that they have an appointment scheduled for today. They should receive paperwork before they come through the registration area that they'll be completing. We will have people here to assist them with the paperwork as they come to the door. And there's just 2 boxes that they need to check and then sign at the bottom. Once they come into our registration area, they'll be directed to one of our registrars. We have 6 registrars here. And then they'll be offered the opportunity to provide their insurance card and their driver's license. If you don't have an insurance card, that's fine. We will continue to do the process without insurance cards. We will need some form of identification just to get demographic information from you. Once you're registered, you're going to be led to another area where you will be lined up to do your vaccination. So there's a vaccination area that you'll go through next. Some of the reminders you might want to consider before you come to the clinic is you may want to use the restroom before you come, because once you get vaccinated and you go into the period of time that you wait, there's a 15-minute observation period, you're not going to be able to use the restroom. We're going to ask you to remain seated and in that area to be observed for at least 15 minutes. So you would want to use the restroom before coming. So driver's license, insurance card, restroom, and then also please consider wearing layers. You may be waiting outside, and you would also want to be able to take off a layer and perhaps have a short sleeve shirt underneath. That'll just make it a little bit easier for you to be vaccinated. Thank you so much.
So now we're in the actual vaccination clinic where the needles will go into your arms. And I'm here with Dr. Barbara Tafani, who runs that for us. And Barb will walk you through exactly what happens through the process and even after you've been vaccinated. With no further ado, Barb, would you mind walking folks through that?
Absolutely.
Thank you.
Okay, so welcome to the vaccine clinic. So you're going to come out of the registration area and into the vaccination area, and you're going to have your questionnaire with you. And you'll have filled that out in the car, as Tony had said. The vaccinators will review that questionnaire with you just to make sure that we have all the information we need. One of the most important pieces of that questionnaire is, have you ever had an allergic reaction to a vaccine? If you have, we'll talk you through what we need to do next. If you haven't, you'll just come right into one of our vaccination stations. You'll sit down with one of the vaccinators. The shot itself only takes a couple of seconds to administer. We'll administer it high in your arm, in your deltoid muscle, and the muscle right up here. I've given a lot of vaccines over the course of the past few weeks. Everyone has said pretty much the same thing. It's a relatively painless vaccine. It doesn't take long. Then you'll leave the vaccine station, but before you go, you're going to get a card. And this card will have the information about what the manufacturer is of the vaccine, the lot number of the vaccine, the date you've gotten the vaccine, and where you got the vaccine. That card is really important. We'll talk about it a little bit more over in the observation area. So when you leave the vaccine station, you'll come over into the observation area, and you'll have a seat in one of these chairs. And we're going to ask you to stay in this area about 15 minutes. And the reason is we just want to observe you and just make sure there is no reaction to the vaccine. The chances of having a reaction are very small, but we want to just take that extra precaution with you. I talked about that card you're going to get. While you're sitting waiting that 15 minutes, one of the things that we're going to ask you to do is take out your cell phone and take a picture of that card, front and back. So that way, if you lose the card, you will still have some record of the information, because that information is really important. You're going to want to know, did you get the Pfizer vaccine or did you get the Moderna vaccine? You're going to want to know the lot number, and you're going to want to know the date that you got your first dose, because you're coming back with us for a second dose. While you're here also, we will have given you some information about the vaccine, and we've also given you a sheet of paper about a CDC website called vSafe. vSafe is a website that you can register on, and they will help you track your symptoms. They'll follow up with you to see how you're feeling, and they'll actually send you a reminder when it's getting close to the time for your next appointment. We encourage you to go in and register on the vSafe website. It's certainly not required, but people who have done it have found it extremely helpful. It's also a great way to collect continuing data about how people are doing with this vaccine, so that we can monitor the success of these programs. When you're finished in the observation unit, you can come over to our social media area, and you can take a picture of yourself, and you can actually send it out to people to let everybody know that you have gotten a vaccine, and encourage other people, friends and families, to do the same. Before you go, I just want to ask you to do one more thing. Pay attention to how you're feeling in the next 24 to 48 hours after you get your vaccine. Most people do extraordinarily well and have no problems at all. But if you are not feeling well, if you are having fevers, chills, body aches, in the first couple of hours, that's not that uncommon in a very few number of people. However, if it continues, or if you have rash, body aches and fevers that extend more than a day, please call your primary care provider. We'd rather be safe than sorry, and no physician will ever mind you calling just to check to make sure that you're okay. Once you take your picture in here with us, and send it out to your friends, you are free to go. And you'll just leave the clinic right through this door, and this patio and walkway take you right back out to your car. We are happy that you're coming to us at Hunterdon for your vaccine, and we will see you again in 3 to 4 weeks.
Thank you to our Hunterdon Healthcare team for providing that tour. We had our first clinic this past Saturday and vaccinated over 500 members of the community. Everything went very well, and we plan to replicate this at the hospital site and at other Hunterdon Healthcare sites as vaccines become available from the state. Now we will get started with the questions that our community has submitted in advance to this program. I'll start with Dr. Prosswimmer, and the first question is, has the Johnson & Johnson vaccine been approved? It's a multi-part, Dr. Prosswimmer. I'm going to give it to you all at once. Do you know when it might be available, and how is it different from the other two vaccines?
Okay, great question. Well, vaccines will help bring the pandemic to an end, so we are very eager to get as many people vaccinated as possible and to have as many vaccines available to give. The Johnson & Johnson COVID vaccine does not yet have emergency use authorization. It's very different from the Pfizer and Moderna messenger RNA vaccines. The J&J vaccine uses an inactivated adenovirus to deliver the spike protein code to the cell. Regular adenovirus causes a cold, not COVID, but the inactivated adenovirus does not. The Johnson & Johnson vaccine is easier to store in terms of temperature and is likely to be a single dose product. More details will be available when the vaccine is released.
Great, thank you. And the next questions are going to probably be handled by Dr. Pulley. The first one is, how will President Biden's vaccination plan improve the availability or speed up the distribution of the vaccine? Rose?
That's another great question. And the answer is we just don't know yet. But we will follow all the communications from both the federal government and the New Jersey state government closely as we learn more about any changes to the vaccination distribution plan.
Great. The next question, again, Dr. Pulley, has there been any update related to who is allowed to get the vaccine, and do you know when teachers will be eligible?
So fairly recently, phase 1A was updated to, 1A includes healthcare workers and first responders, and recently was updated to include those over age 65 and those 18 to 64 with certain health conditions. We remain in phase 1A. Movement to phase 1B is determined by the state, and we have not heard when this might be. But there are many persons in phase 1A waiting to be vaccinated. So we don't know at the current time when teachers will be made included in the phase that we're currently providing vaccine to.
Great, and I'm going to stay with you, Rose. Closely related question here. Have you received any more vaccine to distribute? And I'm eligible to receive it, so when can I schedule an appointment with you?
We held our first large high throughput clinic vaccinating 500 people from our community on Saturday. We hope to have another 500 doses to distribute soon. Watch our social media and our website for announcements. As soon as more supply arrives, we are fully prepared to open more clinic appointments. We plan to distribute vaccine at 3 main sites: Hunterdon Medical Center, our Hunterdon Health and Wellness Center in Clinton, and our Bridgewater Medical Office building.
Great, thank you. Dr. Prosswimmer, the next question is, if I'm able to get my first shot soon, am I guaranteed a second vaccine? Will you go ahead and schedule me for my second vaccine while I'm at the clinic getting my first vaccine?
So to achieve this extraordinary 95% protection from the Moderna and Pfizer vaccines, 2 doses are needed. We continue to expect that the second dose will be delivered to us for everyone who got a first dose, and that we will administer second doses to those who received a first. We've been assured by the state that this will be the case, and we are scheduling those second doses.
Okay, I'll stay with you, Jerry. How can homebound people get the vaccine?
Very, very important question. We know that our homebound community members are certainly vulnerable. At this time, though, we're unable to bring the vaccine off-site because of its sensitivity to temperature and vibration. future vaccines might be easier to transport off-site. And as I mentioned a moment ago, there is one vaccine in development that requires only one dose, which may make it even more suitable for use for homebound patients. In the meantime, though, caregivers who are eligible should be vaccinated to surround those homebound people with as many vaccinated folks as we can.
Great. And one more follow-up to that. If I receive both doses of the vaccine, can I stop wearing a face mask?
Oh, this is such an important question. I'm glad it came up. Getting vaccinated will help keep you and your family and your community healthy and safe. But vaccination doesn't mean you can stop the important measures to protect yourself and your family and community. You must continue to wear your mask, practice social distancing, and perform hand hygiene. And there are two reasons for this. While we know that COVID vaccine prevents sickness, we don't yet know if it prevents asymptomatic sharing of the virus. And the other reason is that no vaccine is 100% effective. We hope that eventually, as more people are vaccinated, things will change for all of us.
Okay, and back to you, Rose, with the next question. I was told to register for the vaccine on the state's COVID website, but I've read that they aren't scheduling anyone for the vaccine. Should I bother signing up on that site?
So the New Jersey Vaccine NJVSS vaccine scheduling system will alert those who have registered when they become eligible for the vaccine. They will also provide information about places in New Jersey where citizens can seek an appointment. However, that system does not make appointments, create waiting lists, or reserve doses for you.
Thank you. Is there a single website I can go to or phone number I can call that will tell me who has the vaccine in stock so I know who to call and schedule my shot? Jerry?
Well, that's a really tough question. So that would be ideal, no doubt about it. But at this point, there is no single source of truth that coordinates all the potential places where you can get vaccinated. We spent a lot of time today talking about being vaccinated here at Hunterdon Healthcare, but there are other outlets where you can go to be vaccinated. The county health department has drive-through clinics at the county complex. ShopRite also gets doses of vaccine, and we're anticipating that CVS, Walgreens, and perhaps other chain pharmacies will be vaccinating as well. And you may also have heard about the mega sites that the state has set up throughout the state of New Jersey. There are 6 of them. I believe the closest one to us is at the Rockaway Mall in the old Sears building up there. And there's also one at the Meadowlands. They're not extremely close to us, but those are places folks can go as well. Unfortunately, though, you would have to check at each of these sites separately to find out what their schedules are and when you would be able to make an appointment. Once again, just a reminder, for here at Hunterdon, keep your eye on our social media, meaning our Facebook page. Don't forget, too, to look at our Twitter feed and our website. And as we receive the product, as the vaccine comes into our possession, we will open up those slots for you to register and give you very specific instructions about how to do so.
Great, and I'm going to follow on with a different question. I read that the COVID-19 vaccine isn't effective for people with anxiety and depression. Is that true?
I can take that question. No, it's not true at all. And in fact, I know that the pandemic has provided enough reasons for all of us to feel maybe unsafe, more unsafe than we usually do. And if you're on medications for anxiety or depression, that we have people at our clinics who can talk to you and review any contraindications. But right now, I don't know of any contraindications for any of the behavioral health medications that are currently prescribed. We have pharmacists on site who'll be happy to take your questions, any questions you have about medication.
Great. Thanks, Rose. I'm going to stay with you for the next question. I got the first dose of the vaccine and need to schedule my next shot, but I hear there isn't any vaccine. What happens if I can't get the second dose in the time frame? Will I have to start all over again?
That's a great question, and we actually get this question quite a lot. We expect to receive a second dose for those who are immunized with the first dose. It is best to get the second dose at the recommended time based on the specific product you receive. However, if there is a delay, you should get the second dose as soon as it is available. There is no need to start over.
Great, thank you for that. Dr. Prosswimmer, the next question reads, a lot of people in California got sick after getting the Moderna virus, is what I read. Can you tell me more about that?
Sure. Many millions of doses have been given in the United States. I checked this morning, and as of a couple of days ago, we were up over 19 million doses of COVID vaccine distributed in our country. We know, therefore, that anaphylaxis, the severe allergic reaction that was mentioned in the California news, is very, very rare. Since we're focusing on every possible safety signal for the vaccine, experts are assessing this further, but let me give you some perspective. Severe allergic reactions to penicillin occur in about 1 out of 5,000 doses. The CDC released data on January 22nd showing that severe allergic reactions to Moderna vaccine occur in 2.5 per million. That is a very, very rare event.
Great. The news is reporting that there is another variant in California that they think is resistant to the vaccine. Is that true? Is the variant here in New Jersey as of this point? Dr. Prosswimmer, do you want to stay with that one?
Sure. So there are varying mutations of the COVID the COVID virus circulating around the globe. There are South African strains, there are United Kingdom strains, and we know that these strains are actually here in the United States. It's not a surprise, they will continue to circulate, but the very good news is that so far, the Moderna and the Pfizer vaccine both are reporting that the new strains are covered by the vaccine. So that's great news.
Great, thank you. And one more here, Jerry. Please explain the difference between Hunterdon Healthcare's vaccination clinic and the Hunterdon County Health Department drive-through vaccination system. Is registration different for each of these? If so, is it up to the public to try to navigate both systems to try to get an appointment?
Yes, persons seeking COVID vaccine have several options to access it, as we mentioned a few minutes ago. Hunterdon Healthcare System is one of the options. Hunterdon County Department of Health is yet another. ShopRite or other pharmacies, yet another. And then the mega sites located around the state that I mentioned earlier. Each one is separate. We have no way of knowing when these other options have available vaccine doses or have appointments. But we'll work hard to keep you informed about what's available here through Hunterdon Healthcare System. So as I mentioned earlier, watch our social media, our Facebook, our Twitter feed, and our website. And as vaccine becomes available, we will let you know.
Okay. Will Hunterdon Healthcare physicians be reaching out to schedule me for the vaccine once their office has the vaccine, or should I go to the clinic?
So some practices may ultimately receive the vaccine, some will not. We are focusing on trying to centralize vaccine distribution as much as possible. Keeping track of the availability at Hunterdon Healthcare System is a good idea, and I would suggest that you accept the first appointment that you identify, wherever that might be. So if you have the opportunity to make an appointment, make it.
Great. Next question. I've been trying to get the vaccine. However, every time I go on the website for the clinics, the vaccine is not available. It is frustrating. I'm trying multiple times a day. How do I realistically get an appointment? Jerry?
This surely can be frustrating, and we really do want to help you. When you're alerted that supply has arrived and appointments are open, that's when you should attempt to schedule. There won't be appointments when there is no vaccine available. So going on repeatedly to try to schedule an appointment by calling won't get you very far because we won't have the product available to schedule your appointment. So bear with us, be patient, be persistent, and we are here for you. We will work with you to try to get you vaccinated. We want to take care of you.
Great, thank you. And I think we should emphasize that we really are just distributed from the state. It's fairly random, and we don't really get much advance notice of that. But is it fair to say that we would put a notification out a day or so before the scheduler opens up?
That is our plan. We want to make sure people have enough opportunity to prepare themselves to try to get their appointments scheduled. And as Mr. Gavin mentioned, we are somewhat at the mercy of the state. We don't know when they're going to send us the vaccine. Sometimes it comes with just a few hours notice. And we don't know how much vaccine they're going to send us. So once we receive it, we'll know how many slots to open up and make it available for everyone using all the systems that we've reviewed several times during our discussion today.
Great. Thanks, Dr. Prosswimmer. Rose, I'm going to swing back to you for a few questions here. Will there be multiple vaccine clinics that any patient in the system may sign up for vaccination?
So as vaccine supplies increase in the future, there will be many more clinics. Currently, our ability to have clinics is limited by the supply of vaccine we receive. So I encourage people to watch for patient portal messages, notices on our website, and for postings on our social media sites for information on when clinics are available and how to register for an appointment.
Great, thank you. Staying with you, Rose, am I eligible because of my age, or I am eligible because of my age, that how can I be alerted that appointments for COVID-19 vaccine have opened up again? Also, I'm a Somerset County resident. Does it matter what county you reside in? Rose?
Yeah. To keep up to date about vaccine clinics, watch media outlets, social media sites, the New Jersey COVID-19 website, and our website. Your county of residence may be a factor in which option you have for immunization. When vaccine is available, since Hunterdon Healthcare has practices in Hunterdon, Somerset, Warren, and Mercer counties, we can offer immunizations to individuals who live, work, or study in those counties. Information about any restrictions should be available to you as part of the communication about vaccine clinics. So read that information carefully.
Great, thank you. And Dr. Prosswimmer and Rose, moving now to questions that are coming in. A few of these came in just before the program, and several have come in during through chat. So I'll ask for whoever wants to respond or both. So the first one is, how can I register to obtain vaccine in Warren County? I signed up with the state, and my husband and I used the doctors at Hawk Point. Jerry, Rose, Jerry, do you want to take it?
Sure, I'd be happy to. So as Rose mentioned a moment ago, we are able to distribute vaccine to any of our patients who live, work, are educated in, or receive medical care in one of the 4 counties that we serve: Hunterdon, Somerset, Warren, and Mercer. You do not have to be a patient of Hunterdon Healthcare to be vaccinated by us, but you do have to fit into one of those 4 categories. If you live in Warren County and you seek your medical care at Hawk Point, then you would be eligible to be vaccinated by Hunterdon Healthcare System. You could also be vaccinated by the Warren County Health Department, or at one of the mega sites that I mentioned around the state, or potentially also at a pharmacy such as ShopRite, or ultimately CVS or Walgreens.
Great, thank you for that. The next question is, I am a smoker and realize I could get the vaccine. I am wondering if I have to bring some documentation to support I smoke. I am hearing that the mega sites do not require documentation. Can you confirm? I am not a patient in your facility. Does that matter? Jerry?
So once again, if you live, work, are educated in, or receive medical care at one of our practices in the 4 counties we serve, you're eligible to be vaccinated by Hunterdon Healthcare System. Like the mega sites, we are not requiring documentation of your risk factor, but ask that you confirm with us that you are in fact eligible under phase 1A criteria. And just to refresh everyone's memory for that, that means healthcare workers, long-term care residents, first responders, those over age 65, and those age 18 to 64 with a specified health condition. And the person who asked this question is correct. Smokers are on that list. So we would ask our people who are getting vaccinated by us to just give us verbal assurance that they meet those criteria.
Great, thank you. What is being done to safeguard patients at higher risk of anaphylactic reaction to the vaccine?
I can take that one.
Rose?
Yeah. Response kits. So we have response kits at the clinics, and individuals who are qualified to respond at our clinics at all times. One of the nice aspects of the Hunterdon Medical Center clinic is that we're on the same campus as our emergency department. So we have multiple methods to respond to a serious reaction in the clinic.
Great. Is it safe to say, though, we would have folks that could respond, nurses, a physician?
Absolutely, right on
site that we set up in Hunterdon Healthcare?
Yes, oh, absolutely,
Great.
Absolutely. And we have part of the observation process is we have clinic assistants and others carefully monitor everyone. We don't stare at you literally in your eyes for 15 minutes, but we have people constantly rocking the room to look to see if any reaction, and then we immediately respond to anyone with any concerns at all, or we see that doesn't look quite themselves.
Awesome, thanks, Rose. The next question is a two-part question about current vaccine eligibility in New Jersey. I'm not quite clear on the definition of immunocompromised or on whether we are currently vaccinating those on immune-suppressing drugs. Would someone taking immune-suppressing infusions for Crohn's disease be eligible now? What about someone who uses a corticosteroid nasal spray year-round?
I'll take that one. So there are a couple of different questions embedded therein. So let me start by saying that persons who have a suppressed immune system are still eligible to be vaccinated. This is not a live vaccine, so there's no danger to the recipient, even if they're taking immunosuppressive drugs or have a disease that suppresses their immune system. The potential downside to being vaccinated if you're immune suppressed is that you may not respond as robustly to the vaccine. Nevertheless, the protection that you get from that vaccine, given your immune suppressed state, can be particularly important for you. To address the two specific questions, persons who are taking infusions for Crohn's disease are in fact eligible for the vaccine, as are people who take corticosteroid nasal spray. Those are not contraindications. So you would have to fulfill the requirements for phase 1A, but those are not contraindications for vaccination.
Great. And the next question is similar to others that we've answered, but maybe just a quick reinforcement on the answer here. So the question reads, I'm a resident of Hunterdon County. I'm trying to schedule an appointment for my dad, who is 89. He is currently living with me, and everyone in our household leaves to go to work or school every day. I registered him on the state website, but never got an email with a link to schedule an appointment. How do I get an appointment through Hunterdon Healthcare? Dr. Prosswimmer, you want to
Just to reiterate, registering on NJVSS, the New Jersey Vaccine Scheduling System, will provide you with messaging when you're eligible and suggestions for where you might want to go to try to get an appointment, but it will not give you an appointment or send you an appointment. You have to do that either directly with Hunterdon Healthcare, if that's where you're going to be vaccinated, or with the county or pharmacy that you plan to use. So you would have to register once we get supply and open up the slots. We definitely want to register and vaccinate your father, given your description, no doubt about it. Something we want to do for you, for him, and for all the members of our community.
Great. Again, similar here, but if we registered via NJ site, does that mean we must wait until I can make an appointment, or must I register via the Hunterdon site? And I think we've said it several times. Rose, you want to reiterate again? It really does seem to be a big question.
Yes, it is a question. You need to register on the Hunterdon site to be vaccinated at one of our clinics. The New Jersey State website right now will not connect you directly to an appointment. So our advice is to watch the communications, watch our website, watch our social media pages to see when registration opens up for one of our clinics.
That's great, thank you. Can the form that needs to be completed on site be available to download so we can have it completed or mostly completed prior to arrival?
That's a great suggestion. Right now, I'm going to have to take that back to my team and ask them if we can operationalize that. I've done that in the past for public health clinics, made it available. One of the challenges with that is that there are different formulations of the vaccine. Right now, we're dealing with Pfizer and Moderna, and in the future, there will be additional formulations of vaccine. So you would have to complete the correct form ahead of time. Right now, for our large clinics, we're giving it to you in the card to fill out. So there's ample time for you to do that prior to entering the clinics. I wouldn't worry about having the form. Right now, the clinics are proceeding pretty swiftly, and you'll go through in about 30 minutes.
Great, thank you.
And I'll add that the form is really quite simple.
Yeah, it's not a complete history like that you fill out at some physician's offices and tell them everything that you've had, right? Is that correct? It's very specific and fairly simple. So it is quite easy.
It is very easy to fill out, and we're actually getting very few questions about the form. People are very good at filling it out. That is not a place where it's slowing down the clinic at all.
Great. Straightforward is how I would describe that.
There you go.
Okay. Have there been any long-term side effects of the Moderna vaccine?
So long-term is the key word there. The vaccine has not been available for distribution for a long term yet. Although it is a new vaccine, the groundbreaking cooperation between the leading medical experts here in America and the pharmaceutical companies globally has made a return to normal possible thanks to the COVID-19 vaccine. The rapid development was due to the sharing of research on a scale that was never attempted before. And every study, every phase, every trial was carefully reviewed and approved by a safety board at the FDA. The process was transparent and rigorous throughout, with continued oversight and expert approval. Having said all that, we have less than a year's worth of data, so we don't know what long-term is going to bring. Part of the reason that you heard about the V-Safe app from Barb Tafani in the video is we want to collect as much information as we can about the vaccine.
Great.
So I hope that answers the question.
Thank you. I think it did really well.
This might be a good time to put out the reporting system. So each person who goes to the clinic receives the information about reporting to the government, the VAERS, the Vaccine Adverse Event Reporting System. So the federal government has for many years, decades, the CDC has collected information about adverse reactions to vaccines. And this is being rigorously done for the COVID-19 vaccine. So if there is any unusual events associated with this vaccine, there are scientists on it immediately. But right now we have no indication that something like that is happening right now.
We've been actually very pleased with the safety of the vaccine. And again, with over 19 million doses given, even something that happens rarely would have sent a signal by now. So we're very encouraged by this.
Yeah, thank you for that. How do we get on the call list to be considered for any surplus doses you may have to use up ASAP? So I think I've been asked this at least 3 times this weekend. And I think it hit the press about a New York site that advertised at the end of the night that they had a few hundred doses, first come, first serve, and it created a traffic jam in New York City. So I think that the point is, Jerry, Rose, do you want to take it?
I can handle that.
Great, thank you, Rose.
Dose management for a large-scale clinic can be challenging, but we have really worked out our process precisely here. We're doing live tracking of the doses we use and our appointment slots. So we've worked with the pharmacist so well that it's really not a challenge that we've had to face too often here. So every dose that we don't want to waste any doses, and anybody who receives a dose is absolutely within the phases to receive that dose.
That's great. And we have, I should just say to Rose and Dr. Prosswimmer, who've done an amazing job managing the clinics and the oversight, that we have wasted very, very few doses. It's in the single digits, correct? It's 0 doses.
It approaches 0.
0, yeah.
Really.
And that is to say how well we manage them through. And we've never turned anyone away at the end of a clinic either. So it really is well managed by our group there. Okay, what are the recommendations for pregnant women for getting one of the vaccines?
I can take it.
Yeah.
Sure. So neither of these vaccines was specifically studied for pregnant women. However, as is the case in any vaccine study, there were some women who were enrolled in the study and inadvertently became pregnant, and there were no adverse outcomes for those women. Given the fact that pregnant women are at increased risk if they get COVID infection, they have the opportunity to decide to be vaccinated if they wish, And they need to take into account a couple of things. One is, what is the circulating prevalence of the virus in the community where you live? So if you live in a community with a high rate of COVID infection, that might influence your decision. And similarly, what is your exposure based on your occupation or your personal circumstances? So if your occupation or your circumstances increase your risk of being exposed to COVID, you might make a decision to be vaccinated during your pregnancy just because of your personal circumstances. And of course, you will always have the opportunity to be vaccinated after you deliver your baby if you decide not to be vaccinated now, as long as you're in the eligible group then.
Great. Okay, thank you for that. What are the recommendations? Can a guardian or healthcare proxy accompany a patient in need of assistance?
Yes, I'll take that one. And the answer to that is yes. We want the fewest number of people in the clinic as possible at a given point in time. However, we absolutely allow a guardian or caregiver to accompany a patient into the clinic to assist them.
Great. Thank you, Rose. The next question is, if you had the first dose at another location, does that mean that you must go to the same location to get the same brand, or can you get the second dose of the same brand elsewhere?
Okay, so that's a very good question, and I recommend that you go back to the same location you received your second dose. And the reason for this is that we account for all our doses. So we get shipments designated as first dose shipments and shipments designated as second dose shipments. So, so that we can continue to receive vaccine and serve the communities that we provide healthcare to and our general community well. We really want you to come back to the same location you received your first dose to get your second dose of vaccine.
That's the site that will get the second dose.
Yes, they will get your shipment.
Yeah.
They will
Literally to the one, right? To the dose. Yeah.
It is. Yeah. I cannot emphasize enough how carefully the state and the federal government are monitoring the use of our vaccine and the doses. We have to account for every dose.
Good. So we would say, really, it's almost a must go back to that same site. Yeah.
And it's really the easiest thing for you to do. I would also point out, while we're on this topic, that make every effort to keep your second dose appointment. It is very difficult to reschedule, and it takes up our time and resources. And so if you got your first dose and you're due to get your second dose and you have an appointment, please keep that appointment.
Sure. Thank you, Rose. And also be watching and making sure that you're scheduling the appointment in that window.
Yeah.
Okay. Is it equally safe for those with allergies at risk of anaphylactic shock to go to our Hunterdon Healthcare's doctor's office or get it done in the hospital, just in case? I think this might be a comfort for the patient question. Yeah.
Yeah, I really like the location in the hospital being co-located with an emergency department. So we do ask every patient who comes through if they've had a response to a vaccine in the past. So we're prepared for that at any location. But if for your comfort level, you feel more comfortable here, that's your choice. It's going to be difficult. It may impact how soon you can get vaccine if you choose to pick a certain location. And in general, I recommend if you get an appointment to take it, because right now the supply of vaccine is not sufficient to match the demand for it that we have. So I think it's probably a better option to just take it at this particular point in time. But if you truly have had bad reactions before and want to have it here at our site, let us know that.
Great. Thank you, Rose. Will they assign a date for your second appointment?
Right. For the high throughput public clinics, we are scheduling the second dose appointment in the registration process when you come through. So yes, you will get a second dose appointment at the appropriate interval when you come through for your first dose.
Okay. The next question is, my expectation is that you do not need medical documentation to prove that you have a condition or are a smoker. Persicelli, I guess, for those who don't know, that is our Department of Health Commissioner in New Jersey, has said several times that it's on your honor to keep the process going. How do you make an appointment? I think we've gone through how you make an appointment, and I think we've already addressed here that we do ask good questions and we ask you to answer honestly, but there is no proof that's needed in any clinic in the state. The whole state is governing them. Jerry, do you want to add to that?
I do. I want to specify that answer really applies to Hunterdon Healthcare System clinics. There may be some county clinics that do request documentation for certain kinds of conditions. While the state and Dr. Persicelli in particular has said that at the mega sites, no documentation will be required, the state has also given the counties permission to create their own guidelines. So it's possible you could go to one of the county health departments and have a different answer to that question. For Hunterdon Healthcare System, we use the honor system. We ask people to be completely honest with us and tell us that they are in Group 1A, and we will take your word for it.
Great. Thank you for that, Dr. Prosswimmer. Can a husband and wife get the shot at the same time?
If they get their appointment scheduled at the same time, then they can certainly get their shot at the same time. There's no reason that they couldn't.
That's correct. And we've seen that. We had a couple.
Yeah.
Had some couples come through on Saturday.
Great. I know some counties, like Union County, recently received some more vaccines. What update or expectation do you have regarding the next delivery? Has there been any communication with the state? So before I take it over to our experts, I will tell you that we are all on calls with the state constantly. With that, I will ask you to just reaffirm what I think we've already said.
Yeah, so we have, as Mr. Gavin just mentioned, we are in constant communication with the state at every level, both by phone and by email. And we are hoping that we'll get a shipment sometime this week. We don't know it for sure. It is not yet confirmed. If we do get the shipment, we'll open up the appointments to go along with the shipment. And I know you've heard us say it over and over again, but I'll say it one more time. Watch our website, watch Twitter, watch Facebook. We will do everything we can to get the word out to our community that we serve when the vaccines arrive.
Great, thank you. So the next question is very specific to Bridgewater. How does the clinic in Bridgewater work, since it is a small office with only one entrance and exit? So I think that this question is coming from someone who goes to one of the offices in Bridgewater and is unaware of our large building in Bridgewater. So Jerry, do you want to add on to that, or Rose?
I think I can take that. I've been to the Bridgewater site, the building, and the address is not in my mind right now, but we do have a large medical office building co-located with Atlantic in Bridgewater, in the Bridgewater area. And it is absolutely going to be a lovely clinic site. We have a throughput worked out for it, and it does have multiple entrances and exits, so it will be an appropriate clinic site. And when we offer appointments there, people can absolutely register for that site, and it may be more convenient to many of our patients than members of the community.
For sure, and just to assure everyone, it's a 60,000 square foot site. It is a very large.
It's a very large site with a large parking lot,
yeah,
with entrances and exits right onto Route 22. So it's going to be a great location.
Thank you, Rose. Okay, how do I make an appointment? Do I call or go online? So it is online, is what I'm hearing. Is call.
Yes. So right now we know we have the call center set up, and we are looking at ways we can do electronic online scheduling. We have not debuted that yet, so stay tuned.
And that would be in the announcement, Dr. Prosswimmer?
That will be in the announcement.
When we announce that we're going to open up for scheduling of a clinic, we would tell you how to access that particular scheduling at that time.
We'll always have a phone number because we know not everyone can use a computer or has access to online skills. But in addition to the call center, we're looking at having online scheduling. It has its own challenges associated with it from the user endpoint as well. So we're working hard to make that available if it makes sense to the community.
Yeah, I'll just add, we would always have a call center to accommodate. Always have a call center so that someone who's not comfortable in using a computer, isn't savvy on the internet, would have a way to make an appointment.
Great, thank you. The next one is the link provided by the state identifies the location, and when you click on the site, it states no records available. How is it that the site is identified and no records are available?
I think this is just one of the challenges of using the state site. I think it's difficult for the state to really on top of everything that's happening at the local level throughout the entire state of New Jersey, which is why we're really recommending that our community members watch our own version of the communications and registration.
Great. I think I'm going to take this question, but I think I'm interpreting it. Hope I'm interpreting it correctly. So it's if a college student enrolled in and attending school in person has medical comorbidities, is there any way to get the vaccine to them when they have to be in person? So I'm not sure if this question is asking about remote vaccination, which we already spoke to because of the fragility of the vaccine. It's impossible for it to be transported. I think maybe just to reaffirm, we will be announcing the sites that we will be doing them at. And as long as folks qualify, they're welcome to schedule to come into those sites. Okay, I've registered at several sites. How do I let them know when if I get the shot already?
I'll take that one. It's important. We do not encourage people to multiple sites. I've seen this happen before in prior pandemics, and it makes it very difficult when we're running a clinic if someone does not cancel their appointment because we're constantly trying to reconcile the appointments and the doses to prepare, which, as you saw in the video prior to this questioning period, it can be quite challenging. So if you have an appointment, keep your appointment. You should receive some confirmation of some kind about your appointment. Do not try to schedule multiple appointments. If you do, I encourage you to cancel one of those multiple appointments. And there should be instructions on canceling your appointment when you make the appointment. Pay attention to what those are.
Great. Thank you. So that concludes our questions for today. Thank you all for meeting with us virtually. I appreciate everyone taking the time, and we hope that you found this program informative. And I would like to extend a huge thank you to our panelists, Dr. Prosswimmer and Dr. Pulley. Thank you.
Pleasure to talk to you today. Thank you, everyone.